Welcome to this video on vitamin D. You can see the chemical structure of vitamin D here, often called the sunshine vitamin, presented by Medicos Online. We will cover the introduction, different types, metabolism and absorption, storage, functions, requirements, sources, deficiency, and toxicity of vitamin D. Vitamin D is a fat-soluble vitamin with anti-rickettic activity. It's synthesized upon sunlight exposure. Biologically inactive forms require enzymatic conversion in the liver and kidney for activation. Vitamin D comes in several forms. Vitamin D1 is a mixture of ergocalciferol with lumisterol. D2 is ergocalciferol. D3, cholecalciferol, is made from 7-dehydrocholesterol in the skin. D4 is 22-dihydroergocalciferol, and D5 is cytocalciferol. The two major forms are vitamin D2 or ergocalciferol from plants and vitamin D3 or cholecalciferol from animal products. D3 is considered more biologically active in dairy calves. Vitamin D metabolism involves synthesis in the skin from sunlight or intake through diet. It is then processed by the liver and kidneys to its active form, which helps maintain calcium and phosphorus balance for various functions. Vitamin D is absorbed in the small intestine associated with fats, requiring bile salts. Only about 50% of an oral dose is absorbed. Sufficient vitamin D is generally produced via daily sunlight exposure. Cholecalciferol is produced when 7-dehydrocholesterol in the skin is irradiated by UV light. This leads to pre-vitamin D3, which then isomerizes to vitamin D3. It is then absorbed and transported in the blood. In the liver, vitamin D3 is converted to 25-hydroxy-vitamin D3. This is then transported to the kidney and converted to the hormonally active form, 1,25-dihydroxy-vitamin D, which is essential for calcium and phosphorus metabolism in the body. The production of the active form, 1,25-OH2D3, is tightly regulated by parathyroid hormone in response to serum calcium and phosphate levels. It is transported in mammals by a protein called transcalciferin. Vitamin D is mainly stored in the blood and liver, but also in other tissues like the lungs and kidneys. It is released slowly during deprivation. It is excreted mainly in the feces. Maternal intake helps prevent rickets in newborns. Vitamin D plays a critical role in various bodily functions, including regulation of immune function, calcium and phosphorus homeostasis, bone mineralization, insulin secretion, and cell proliferation and differentiation. The primary function of vitamin D is to raise plasma calcium and phosphorus levels for bone mineralization and other functions. It also regulates immune cell functions, insulin release, and reproduction. 1,25-OH2D3 regulates gene expression by binding to tissue-specific receptors. The active complex for mediating positive transcriptional effects involves a heterodimer of the vitamin D receptor and a vitamin A receptor. Vitamin D stimulates the active transport of calcium and phosphorus across the intestinal epithelium. It promotes the synthesis of calbindin, a calcium-binding protein, and influences magnesium absorption and calcium-phosphorus balance. Regarding bone effects, vitamin D is crucial for both the mineralization and mobilization of bone mineral. Deficiency can lead to rickets in the young and osteomalacia in adults. It also helps mobilize calcium from bone to the extracellular fluid compartment and aids in collagen biosynthesis. In the kidney, vitamin D improves calcium reabsorption in the distal renal tubules, mediated by the calcium-binding protein, calbindin. While 99% of filtered calcium is reabsorbed without vitamin D, the remaining 1% is hormonally controlled. Without intact PTH, vitamin D increases renal loss of phosphorus. Beyond bone mineralization, vitamin D regulates over 50 genes. It is essential for embryonic development in chicks, including yolk calcium mobilization. It also inhibits the growth and proliferation of certain malignant cell types, such as leukemic, breast, and colorectal cells, and deficiency may promote prostate cancer. Ruminants with adequate sun exposure may not require dietary vitamin D. Requirements become important without sunlight and are influenced by the amount and ratio of dietary calcium and phosphorus, their bioavailability, species, and the animal's physiological state. Rickets was once called the first air pollution disease. Dietary vitamin D requirements vary by animal. For example, beef cattle require 275 IU per kilogram. Dairy cattle's growing bulls need 300, and lactating cattle need 1,000 IU per kilogram. Goats require 1,400, chickens 250 to 300, and dogs require 221 IU per kilogram. Vitamin D precursors include ergosterol in plants and 7-dehydrocholesterol in animals. Ergocalciferol is in mushrooms, and cholecalciferol is in fish. Sun-cured forage is a primary source for farm animals. Saltwater fish oils are very rich sources, and vitamin D3 is the main supplement for livestock. This table lists the vitamin D2 concentrations found in representative feedstuffs, indicating which sources provide higher levels of this nutrient for animal diets. The primary deficiency disease is rickets in young, growing animals, characterized by decreased calcium and phosphorus in cartilage and bone. In adults, the counterpart is osteomalacia. Symptoms include weakened, deformed long bones, enlarged joints, stiffness, and beaded ribs. Osteomalacia in adults involves progressive demineralization, leading to fractures. Other deficiency signs include reduced performance, hypocalcemia, reproductive failure, decreased appetite and growth rate, digestive disturbances, and occasional tetany or convulsions. Skeletal symptoms include joint enlargement and bowed legs. In cattle, a normal plasma 25 OHD3 range is 20 to 50 nanograms per milliliter. Deficiency in calves starts with thickening of metacarpal or metatarsal bones. Severe deficiency causes long bone bending and twisting, as well as the characteristic beating effect at the ribs. In deficient calves, the mandible may become thick and soft, causing difficulty eating, slobbering, and tongue protrusion. Joints become swollen and stiff, and posterior paralysis may occur from fractured vertebrae. Advanced stages show stiffness, weakness, and cessation of growth. Calves of deficient dams may be born dead or weak. Older animals with osteomalacia have weak bones, fractures, and potential posterior paralysis. In dairy cattle, deficiency can decrease milk production, inhibit estrus, and lead to hypocalcemia such as milk fever. Milk fever, or parturient paresis, is a metabolic disease in dairy cows characterized by hypocalcemia near calving due to a failure of calcium homeostasis. It is influenced by prior calcium and phosphorus intakes, vitamin D intake, dietary ratios of certain minerals, age, and breed. During milk fever, serum calcium drops significantly. Affected cows lie on their sternum, head turned to the flank. Untreated paresis progresses to coma and death. Intravenous calcium borogluconate is an effective treatment. Prevention involves feeding a low-calcium diet prepartum and a high-calcium diet postpartum. Vitamin D deficiency in sheep and goats occurs in young animals confined without access to sun-cured roughage. Clinical signs are similar to those in cattle, including rickets in the young and osteomalacia in adults. Parturient paresis can also occur in ewes. Vitamin D deficiency in swine leads to poor growth, stiffness, and lameness. Other signs include frequent fractures, soft bones, bone deformities, and the enlargement and erosion of joints, which are characteristics of rickets. In poultry, vitamin D deficiency causes rickets, reduced growth rate, and lower egg production and hatchability. Severe cases result in weak legs, rubbery beaks, skeletal distortions, and defects in endochondral ossification. Excessive intake of vitamin D can lead to toxicity, which is a serious concern for animal health. Vitamin D toxicity leads to elevated serum calcium, causing inflammation and calcification of soft tissues, such as kidneys and arteries. Symptoms include anorexia, weight loss, joint pain, and stiffness. Vitamin D3 is significantly more toxic than D2. Ingestion of the shrub, Solanum malacoxylon, by grazing animals causes enzootic calcinosis, often called anteque seco. This is due to a calcinogenic factor that dramatically increases the absorption of dietary calcium. However, general vitamin D toxicity is uncommon in practice. In conclusion, vitamin D is a vital nutrient for animals, essential for bone health and overall well-being, but must be managed carefully regarding both deficiency and excess. Thank you for watching this video on vitamin D.